Okay, welcome back. Just before the break, we were talking about Shahira and the disorders that she suffers from, and we were talking to Reshna Redivan from DKMS. Now, I want to talk about Shahira, but she is so young, she can't talk back and give us the right answer. So we'll be talking to Shafin Khan, Shahira's father, and Amina Khan, Shahira's mom. Welcome. Shahira is still very young, but when in October 2019 you realized that she had this disorder, what was your reaction and how did you find it out?
So, prior to this, Shahira was born a healthy child, baby. And just before she was about 9-10 months old, during the winter period of December 2018, she had 2 episodes of bronchiolitis, which she had to be hospitalized. In that time, she developed ear and nose infection, which continued when she came back home. And we went to the GP to get treatment, but continued to be this problem she's had. So when we went back to the hospital for her routine checkup, the pediatric consultant couldn't believe it had gone on for some time and suggested to do a blood test as well as a swab. And in the meantime, we referred her to the ENT specialist as well as the immunology specialist.
Right.
And within 2 to 3 weeks, they got the results. And they found that her white blood cell count was abnormally low, and she had a type of common ear and nose infection. So in that time, she had treatment for the infection, which she got better from. And in the meantime, she went to see the immunology specialist. She had a mysterious wet rash, which she went to the dermatology department as well. So this was about April 2018. Now, if you can remember,
This was over a period of few months, isn't it?
Yes. Yeah. So unfortunately, in the summer of 2018, she developed a type of...
she had a rash, abnormal rash in the skin. So the doctor cannot find what is the relation of that one. That makes, contradictory of this disease. And then they decide to do, biopsy. So,
right.
So it has been done and result was negative. So I think we fallen sick in July, end of July. 31st of July. So she admitted in the hospital, and this time doctor confirmed that she had a low white blood cell, and she cannot produce enough the age. And then they did the further test, and then from that she her actually her white blood cell, which is to fight back the diseases, this is quite low. It's gone to 0. So within a week time, it come back, but this possibility, she got sepsis, I think. Yes, sepsis. So that's why Professor decided to certain medication to continue. So they did the further test and then found she actually immunodeficiency disorder. It was confirmed 2019. It takes a long time to sorted out a different hospital in London. So we have been gone through, and it is actually a painful experience. As a little.
I'm sure it was very painful for any parent. It would be. Then, did you try to find a donor at that moment, or you were not aware of it?
So, doctor is only 2 hospital does bone marrow in UK, which is London is Gosh, Great Ormond Street Hospital, and
Right.
another one is in Scotland. So
Bone marrow transplant
yes,
specialist.
specialist hospital for children only.
Yeah.
So we have been referred there, and we have been seeing quite a few appointments, and they told us to immediate member can be a donor. So this is actually my family. Most of them are in Bangladesh, and Amina family is here. So we organized for Amina's family, and then we decide to bring the sample from Bangladesh, and we managed, but it was very stressful journey. But I can say that they help us. Actually, though it is a blood sample, but Bangladesh government count as a organ. So human organ, not part to send outside of the Bangladesh.
Yeah.
So yeah, so then we organize. Our relative is coming, so they bring in those things. But we got a
But it was only the swab, isn't it?
Yeah, no, it's
not an
swab.
organ.
It's blood
Yeah.
itself, because immediate family.
Immediate family is blood
Right.
sample. Yes.
So we brought 28 sample from Bangladesh, and
How did you manage to bring 28 samples? See, must have been quite a job.
Yeah. Actually, I mean, government restricted over there for transport and carrying blood samples. So then we find very difficult from they don't want it to. Then we go back to the government official, airport official. So we three ministry. We got a permission verbally. So at the end, we allowed to be. Luckily, we sample and has been tested in a lab.
And that blood sample was it of any use here? Was it tested and yep? And could they find out if it could be suitable for anybody?
Actually, they got the result, but we cannot put there in the database like DKMS does. Unfortunately, Bangladesh doesn't have any database. India, they have a database, DKMS and DATRI, another organization, they do, but unfortunately, our country doesn't. So we research on it, but we can be possible, but need a sponsor and organized way we can do it, but it's a big job. We need help, DKMS or any other organization want to do that.
Right. When you were in Bangladesh trying to get the samples and swabs, what sort of reaction or reception did you come across out there in Bangladesh? I mean, I know that government restrictions are there, the rules are there, but the general public and the doctors whom you met must have, how would they react there?
Doctors are very cooperative and they knows, and most of doctor are my family members, and they are interested to do these things, and they helped their weight. And actually, it is transportation is the difficulties, but there is a lab, is Indian lab in Dhaka. So they organize, privately to collect the sample and process right way, is follow the guidelines from Ghosh Hospital. So, they have collected, accordingly, and within 24 hours, we are able to bring those things in London. So, but it takes more than 1 month from organize everything.
Did you talk to the doctors there that if they could establish something like DKMS or any other organization that could help people suffering from blood cancer?
Yes, it's very expensive for Bangladesh to do this sort of treatment. However, the doctors are very knowledgeable, and they doing research on Dhaka Medical College and BSMU. So they are interested, but they need support from a charity organization.
Right.
So they're interested to set up like database. It will help lots of people. People are dying cancer in Bangladesh.
Yes. They don't have proper cancer hospitals there, but I think some new hospitals have come up, and they are dealing with such cases. But what we need is possibly a very well organized, with robust conditions and properly educated doctors who have the experience to treat cancer patients. See, because cancer is everywhere. It's not that limited to this or that country. See, the only thing is that people die without treatment, or those who can afford, they can go abroad. See.
Yes.
So you can imagine that Bangladesh has got a 30 years alive patient who recovered from blood cancer. So they have done bone marrow, but they are about 30 years before.
Yes.
So they can do it, but there is no database that is the,
Is organizing, I'm going to ask Reshna as well, is organizing or going about collecting information, is it that difficult? Having a database, is it that difficult? To my little mind, it seems that it should not be that difficult, it should not be that expensive. There has to be a desire. Reshna, are you there?
I am here, yes. So I think there's definitely, the desire is a key factor. The other factor that needs to be considered is how will they collect the samples and analyze the samples, because it's the sample that will give you the information you need to see whether somebody is a matching donor or not. So they test the blood, or they test the swab, the saliva in the swab, to actually see how close a match someone can be. And so I think that's the complicated part of the process. So if they don't have the facility to do that testing, then it can become a little bit more difficult to actually set the database up.
When you say if they don't have the facility, is that facility so complicated, or is it facility expensive?
It's probably both. So I don't know fully the science behind it, but I do know that when we receive our swabs, we have to send them to a specialist centers in Germany. So we have our own testing center, and they run various tests on the swabs to sort of identify key information about the patient, and actually some of the information, which is mainly sort of very similar to DNA, they extract from the swabs, and that's the information that then goes onto the database. So it's more than just names and addresses of people, but actually some medical information about people as well.
Right. Has DKMS or any other international organization zoomed in on Bangladesh about this serious matter?
So at the moment, DKMS certainly hasn't, and I don't know whether we are looking at Bangladesh as an opportunity for the future. But it sounds like at the moment there aren't any other organizations there who do this work either, unfortunately.
Until then, we will have to wait and see and leave it in the hands of fate, is it?
I have spoken to Datri India. They inform us they need organization funding from different organizations. They can help to set up a charity. You can say like India got it like that, but it's a fund.
All right, Shafin. At this moment, we need to take a break, and when we come back, we'll continue with this discussion. Okay?
Thank you very much.
Thank you. Thank you. We'll be back soon. Thank you. We'll be back soon after this very short break. Thank you.